It is the most commonly inherited blood disorder in the United States, according to the American Society of Hematology, and impacts more than 100,000 Americans.
Yet awareness is limited about sickle cell disease. CBS 6 anchor Janine Samuels is at the American Red Cross here in Richmond to kick off our coverage on the disease and its impact on those who have it and their families. Janine?
Yeah, that's right, Julie and Cheryl. My coverage this evening here at the American Red Cross in Richmond is dedicated to increasing awareness about sickle cell disease and to get a better understanding of how this blood disorder impacts Americans, including Virginians. Let's take a look at some of the data. Now, according to the CDC, sickle cell disease occurs in about 1 out of every 365 Black or African American births. Sickle cell is also common in Spanish-speaking regions in the Western Hemisphere and in people of Middle Eastern, Asian, Indian, and Mediterranean descent. Now, the median life expectancy is between 42 and 47 years old. In Virginia alone, the health department estimates that 2,500 to 4,500 African American residents have sickle cell disease. Now, since Virginia added hemoglobinopathy screening, which tests for blood disorders, to its newborn testing in July of 1989, about 75 newborns have been identified yearly with sickle cell disease. Now, what this means, if you were born before 1989, you could be a carrier of the sickle cell trait. If you have a child with someone that also has the trait, there is a 25% chance that your child will be born with sickle cell disease. We want to share the stories now of 2 men born before 1989 who have thankfully well surpassed the life expectancy for someone with sickle cell disease and who are both thriving in spite of the painful disease.
The pain has been so bad that I prayed to God to let me die.
George Carter of Richmond remembering the havoc forced on his body for the first time at the age of 5.
They took me to the hospital, and doctors knew so little then. They removed a gland from under my arm and thought that was going to take care of the crisis. Of course, it didn't.
The real issue was far sinister. It was sickle cell disease, a genetic disorder passed down from a child's parents, changing round red blood cells to a sickle shape, making it hard to easily pass through the body. According to the CDC, signs can begin as early as 5 months.
Every step was the most excruciating pain I've had.
Then the sting of the doctor's words his freshman year in college.
You probably won't live past 21. I don't have mama there to cry on. So that was a hard day.
According to the American Society of Hematology, the national median life expectancy is 42 to 47 years old. However, 7 decades and a manifold of ups and downs later, George is still standing at 77, now helping others stand strong through the Sickle Cell Association of Richmond.
With a birthday card, for instance, somebody remembered you on your special day. That means something.
He has a heart for people with sickle cell and their families.
James Frazier II, a pharmacist at Richmond Community Hospital, thriving at the age of 60, an immediate connection after meeting George 20 years ago.
I remember a physician telling my mother that I would not make it past 20 years of age.
Another prediction not standing the test of time. Dr. Wally Smith, a physician and scientist at VCU Health specializing in sickle cell research, explains why so many patients suffer in silence at home.
Just imagine if you didn't have sickle cell disease, but you broke your leg. It's hurting. You come to the emergency department. They can actually see your broken leg. It triggers a response. Sickle cell disease, that visual cue is not present.
But I have 2 ports. One, they draw blood out. The other, they give me blood. I call it an oil change.
James hasn't had a major crisis in 10 years.
We can be just as important, just as popular, just as successful as anyone else.
You can have a very productive life. Enjoy it. Don't overdo, but enjoy it.
All right, so inspiring. So how have George and James surpassed the median life expectancy? They say healthy habits play a big role in managing sickle cell disease. So here are some tips for you. Eat healthy foods, have a balanced diet, and drink plenty of water. Especially any other fluids, but especially water. Exercise, build up your muscles and bones. Avoid tobacco and drink alcohol in moderation. Get plenty of rest each night. At least 8 hours is recommended. And last but not least, avoid stress whenever possible. Now, both George Carter and James Frazier stress the importance of knowing your sickle cell status, which can be determined with a simple blood test. They, along with Dr. Wally Smith that you heard from as well, also encourage you to visit a blood donation center like this one to donate blood. You could literally help save the lives of people that need transfusions or even exchange transfusions like James. One donation alone will save 3 lives. Now, another way you can help the sickle cell community is by spreading awareness and donating your time, your money to organizations like Oscar, the Sickle Cell Association of Richmond. Now, you can find George and his team at sicklecell-richmond.org, or you can call 804-321-3311.